We looked at ctDNA and specifically tumor-informed ctDNA using the Natera Signatera assay in patients undergoing definitive chemoradiation for anal cancer. What we found was actually quite exciting was that first, at baseline or pre-treatment, 85% of patients had a detectable ctDNA. And this is in patients who had non-metastatic, so stage 1, 2, and 3 anal squamous cell carcinoma. So that was actually quite high and quite surprising to see such a high rate of detectability, even in patients with early stage disease. The second kind of surprising fact was that 50% of patients actually cleared ctDNA midway through treatment before they even finished chemoradiation. And that's really stands out in terms of anal squamous cell carcinoma because the clinical response assessment normally doesn't happen 3, 4, at times even 6 months later. And so this was now not even post-treatment, this was mid-treatment clearing the molecular disease indicator. And 95% of patients had clearance, the week after they finished chemoradiation. So we're very enthusiastic that ctDNA may be an early response, an early molecular response indicator that correlates with clinical response that we can use to monitor treatment and potentially in the future even think about using it to design trials to personalize treatment for patients with anal squamous cell carcinoma.